I think it's just about ready to start. Come on, please.
What's it saying on your end?
It's just working. It's trying to open youtube.com/watch. On my screen, on my other computer, it says recording and it says live on YouTube. I can see it on my other screen. So I'm logged in. Okay. You see the ceiling, right?
Yeah, I see the ceiling.
All right, so you're on YouTube?
Yeah.
All right, I guess we're good to go.
Go.
All right, I'm not touching a single thing.
Well, just let them know that. Maybe Eric shoot them an email then and just let them know that they're going to be live right.
Okay. All right. Okay. All right. I'll let you go then. All right. Thank you. Bye. Okay. Bye.
Where is it? You're live right now. Now we're going to be able to call off the this. Huh? Yes, All right.
Welcome to Zoom. Enter your meeting ID, followed by enter your participant ID, followed by pound. Otherwise, press pound. You are in the meeting. There are hosts. This meeting is being recorded.
The lab. Yeah. We're just. We're gonna get started in just a minute. Just waiting for everybody to show up.
Hi, Eric. This is Thielen.
Good afternoon. We're gonna get started in a couple of minutes. We're still waiting for people to sign in.
Okay, no worries.
All right, good evening, everyone. We're gonna go ahead and get started. I see several people's names already. I see Dr. Myers, Marla's, Alex, and Wendy. And Dr. Newton, I know, is on the phone. Is there anyone else on? We actually do have a quorum. If Wendy can have you lead the meeting. But before we do, I just want to remind everyone that we are going live, and we are in the public realm, so just remind you of that in terms of your comments and so forth. So, so with that, Wendy, do you mind starting the meeting? Gotta take you off mute. You have to be on mute. You're still on mute.
Is that better?
Yep, there you go.
Okay, sorry. So
That's all right.
we'll call the meeting to order. We have a quorum. So if we can first take a look at the minutes for last month.
And they're a little different than previously because they're actual, the transcription of the live meeting that we had last week. So it reads more of a transcription than a minutes.
Do we have a motion to approve the minutes?
I'll move.
A second?
Second.
Thank you.
Okay. All in favor?
Aye.
Aye. Okay. So now we'll move on to the audit of claims.
Good evening.
Good evening.
Did everyone get the reports that were sent out?
Yes.
It was sent out.
Yes.
So our expenses are looking a little bit more like normal now. Everything's, we're caught back up with the, being at the meeting is a normal time now. We're caught back up. Preschool expenses are about back to normal, except for the transportation costs. Obviously, we still don't have any of those. The only thing that's a little above normal, you'll see, is under the federal and state program. We ended up paying this month all the interpretation services that we had related to the cases at the motels. Those are covered by a grant, at least. Those were the only things that were out of the ordinary from normal, each from month to month. There will still be a little bit of interpretation services in next month's payments, but it'll be much smaller than this month.
Anything else, Sean?
Nope, that's it.
Okay, any questions of Sean? Do we have a motion to approve the audit of claims?
I'll move.
We have a second?
I'll second.
Okay, all in favor?
Aye.
Aye.
Aye. Okay, that's passed. Now moving on to our COVID-19 update.
Okay, I'm going to start with the numbers and then I'll go over some of the things that we're addressing right now. First of all, as of 4 o'clock today, we have 378 positive cases. That's one new case today. We have currently active 20 cases that are active. 341 people have recovered. We're still at 17 deaths. We've tested a total of 8,172 individuals. Of those, 7,794 were negative. We currently have 48 people that are being quarantined, and we have 746 people who have completed quarantine. We have a couple of, I guess, we have a cluster, as you might be aware, in Casanova area. Over the last since last Monday, we've had about an increase. We had 16 new cases since last Monday, a little over 2 a day, which isn't bad. But 10 of them happen to be in one familial household. So if you take those out of the mix, we have less than 1 a day for the last week. So we also had some, I think we found out in the media today, there was a fast track here in Canastota had closed due to a positive case. We finally were able to get a hold of the state to find out whether or not that was a confirmed positive, which it was. The individual lives, I believe, in Oneida County. So Oneida County will do the investigation, but we are, since Fast Track already put out the press release, we don't have to do that. We did have a positive individual go to the Red Apple in North Oneida. So we're putting out a press release to that effect. I believe they were there yesterday between like 6 and 8 o'clock, somewhere in there. We'll be putting out a press release to that effect. We put out a press release about a week ago. I think there was a positive case that had been at the Brewster in Cazenovia. And then also there was an employee at the Point Place, was the name of the casino up in Bridgeport. And so we're working, so we put those press releases out to inform people. Other activities that we're doing, we've been upstate, their mammography van did testing last Thursday. I believe we did 56 individuals last Thursday. Those all came back negative. That testing site was in Wampsville. We also are partnering with Nicentia, which is a home care agency out of Onondaga County. They did some testing last week. They're targeting our senior homes and senior apartments. They did testing last week down in Morrisville. We're still waiting to hear on the results for that. They have also scheduled, I believe this coming Wednesday, they will be doing some testing at the Stoneleigh housing. So on testing, we're more than 2, sometimes 3 times higher than our daily testing requirements for the metrics for the state. So we're really in good shape for testing. We have no one in our 2 hospitals that are related to COVID cases, which is also a good sign. So our hospitalizations in that area are really good. I think I think that's about it at this point, unless you have some questions.
Yeah, I'm just wondering, was there another one in Cas today?
I'm not aware of another one in Cas. We had 1 positive today. All I know is this person works in Oneida County in a nursing home, but I'm not sure if they live in Cas.
And yesterday, is that also?
No, the 3 we had, I think there was 3 yesterday, 3 new. None of them, one was, actually one had moved to Erie County, so we transferred that case to Erie County. The other 2, I know what the individuals were. As to where they live, that I don't know.
Okay. And is the...
But they were unrelated to the cases in Cas. That I do know.
So
I don't
has the tracing been done on the outbreak, if you will, in Cas from last week?
Yes, I believe that's been done. Like I said, for the most part, 10 of those cases were in one family household, so that was
right. So the tracing wasn't that extensive then, huh?
No, they had indicated they hadn't really been anywhere, so we have to go from their word on that. And then we've the other 2. Well, one was, I believe we've been able to finish the tracing on all of those. I just had to run them through my mind real quickly here.
Okay.
Any other questions on the COVID-19? I guess the big challenge now is just keeping people to wearing a mask and social distancing. We hear about all the other outbreaks across the country, so We'll continue to stress the importance of that. I think people are just burnt out and exhausted with dealing with COVID, but we do have to keep pushing that message. We've also been, we had a meeting, I think a week ago, with the 3 colleges to talk to them about their plans for reopening in the fall. We went through basically the same guidelines that were issued by the state today for school institutes of higher learning. We kind of had a copy of that last week from SUNY Morrisville. We were able to use the basis of our discussion. I think all 3 schools look to be opening back up, God willing, but you know, that they're going through all their planning processes, had some questions on how that was going to work and coordinate with us. So it was a good discussion to have with them. I think they're in a good place in terms of planning wise, but we'll continue to meet with them and answer questions they have as we go forward. So I don't know if you have any more questions on COVID-19.
Okay, thank you. Moving on to reports. Alex, anything from the county?
Nothing.
Okay. Eric, your report?
Yeah, there's still some COVID related stuff, but I put it under my report so I could talk about something else. We are currently working on a project that it's a partnership with Syracuse University. We're gonna pilot this project for 3 months, hopefully August, September, late July, early August, September, October. Basically what it is that we're going to be sampling wastewater treatment plant, the influent as it goes into a treatment plant for COVID-19. From the literature that we've seen and from this particular project, there's a strong correlation between what they are able to find in the wastewater stream and what it kind of occurs when they see an elevation in the number of samples with COVID-19. About a week later, you start to see a rise in COVID cases in people. So it's kind of like an early warning detection system, if that makes sense. So we're going to pilot that. We have SUNY Morrisville and then the village of Chittenango. Both of their wastewater treatment plants have agreed to participate with us on this. So we're in the initial stage where we're going to have a conference call later this week to kind of have everyone introduce themselves and start talking about this. So hopefully from that, if this works, we might have an early detection system that we can use to identify potential hotspots or areas in the county. Hopefully, if it goes according to the literature, about a week before they occur, so we can start target testing and addressing those spots. So it's kind of exciting, encouraging on one hand, but I'm not real excited about testing wastewater influent, but I'm not the one handling it, so.
And then, Eric, just to clarify, that's not to suggest it's the wastewater itself that's infectious. That's just a marker for the presence in the community? Correct,
because people are shedding it and going into the wastewater stream, and so they're using that to see kind of I think they're seeing what's coming out of the system. So yeah, it has nothing to do with the wastewater. It's just the medium that they're using, and it's probably a better way of looking at the community and what's going on in the community. The challenge with us is that like public water drinking systems, about half of our constituents are not on a public wastewater treatment system, like on private septic. So it's not going to address those, but it's going to give us they are in the most populated communities. And if we do SUNY Morrisville, we have both the college. One of the concerns that I have is with the college students coming back in the fall, that could potentially be a hotspot for us. And so having the wastewater tested before they arrive and then the first 2 months while they're there may give us a good indication of what's going on. Another good thing is that on the SUNY Morrisville, the Krause Community Center, the nursing home is also on that same system, so we might be able to get an idea of what's happening there. In the Chittenango, as you already know, that'll capture the Grand Nursing Home in Chittenango. It's possible we can get a couple others like Casanova as well. I know the wastewater treatment plant will do it. It's a matter of funding to get them to do that. And we're working with Syracuse University to see if they could help out with cover some of the costs of additional sites. If we get CAS, then we also have another college. And plus, with the recent activity in CAS, we'll have these testing or pilot testing sites in those areas where we're seeing the most activity. So, and Colgate, I believe, was going to sign on itself to work with Syracuse on this, so we could potentially have results from Colgate, which would include the college as well as the hospital, so, and the village. So if we get those 4 on, we'll have a really good representation of the community, plus vulnerable or target population groups as well. So,
Well, just not to get too much into the weeds here, but how does this work? Do they start with a baseline? Because I would think you'd have COVID in the wastewater to start with, and then they see an increase. Is that the idea?
Yeah, it's almost, I think I sent you guys the white paper on it that was sent to me from Syracuse University. And if you look at that, the correlation is almost a 1-to-1 correlation in terms of the rise in COVID found in the wastewater. And then a week later, you see a rise in the number of human cases. So we're hoping that's a good early warning detection center. But back to your question, yes, if we go at the end of July, early August, that's going to be whatever the baseline is at that moment. And then with the college students, especially coming back in, if we see an increase, we'll be able to pick that up, hopefully at least a few days ahead of time, so that we can actually turn around and either target test or do whatever we need to do. We're only going to run it for 3 months and see it. I know Syracuse is trying to get the state to kind of do this statewide. So hopefully this pilot work will help contribute to a statewide system for that. Because as you know, with this COVID-19, we're always about a week behind the testing. So it's always difficult. So basically we're finding out where the virus was, not necessarily where it is.
Mm-hmm.
So I'm hoping I'm excited about this. Hopefully this will give us some heads up lead time on where it could potentially be so we can take action.
Well, I've understood that maybe it's at SU, that one of the things they're doing is being able to test out of a specific dorm. So if they find it rising around a dorm, they'll go in and test more targeted in that dorm. And I'm wondering how far up the chain you could get with a place like Morrisville or Cass.
Right. We've had the discussion with Morrisville about, Cass College is on the community system. It's not a separate, where SUNY Morrisville is specific to SUNY Morrisville, their wastewater treatment system. It's separate from the village. So with SUNY Morrisville, we actually had that discussion with them. They wanted to test the different dorms. For this project going forward, since the county has some grant COVID-19 funds, we're going to help pay for the baseline. But if they want to do, which is just the influent into the treatment plant, if they want to do specific buildings on the campus, then they have to pay for those additional samples. So that'll be up to them. But yes, you can do that.
Hmm.
So that's the one project. The other project we're working on, as you know, we've had that individual water system grant for 5 years from CDC. CDC's come up with a new 5-year grant. Basically, it's a different title. It's environmental health, strengthening and environmental health capacity using data and evidence-based programming. We basically can use the same grant to continue the individual water system project that we had and expand it. Our focus will be kind of like those residences around the lakes that have gone from seasonal to year-round that are still either drawing water from the lake or also discharging into the lake. We're going to be including testing for cyanotoxin, which is for the harmful algal blooms. So it's a continuation of our grant from the before, our project from before, but also expanding it to look at more recreational water quality in addition to individual water systems and the water quality from the lakes. So
Hi, this is,
great.
are
Go
you, I wonder what lakes are you're gonna test the lakes in Madison County? Or what, like all the lakes or?
It depends on, well, what we want to do is identify those residences around the lakes that are pulling water for the lake for either their private water or they're like, and we're seeing a lot of seasonal homes being converted to year-round, but they're not upgrading their water or septic systems. And we believe that's part of the contribution to the algal blooms, the organic loading into the lakes due to the increased residency around the lakes. So we'll still be testing the individual water systems in other areas of the county where we didn't have a large turnout, but we also want to expand it to capture all the growing residents, year-round residents around the lake. And because of the lakes, we'll do as many as we can. You know, people have to volunteer for us to do this, but part of it will also be probably testing from the lake in front of where their residence is to see what kind of water quality they're drawing in. Our only testing at lakes right now is really on the public beaches. So the rest of the lakes, we have no idea what's going on. But as you know, algal bloom doesn't always occur right at the public beach. It could occur elsewhere. And so it could be affecting people without us knowing it. So that's part of the thing is we'll be able to test for that stuff for those residents that are actually drawing from the lake. And we still have a lot of people that are drawing from the lake, as well as have septic systems that might be going back into the lake. So we're going to start looking at that issue a little bit more, especially because that ties in with the algal bloom, which we think is another big important environmental hazard. We see that growing every year, so it helps us start to work on that more as well.
Great, that's a big issue.
Yep. So this grant is due next Tuesday, so we're working on it right now and hopefully have that submitted. And then if we get that, that'll be for 5 years. So I'm assuming it's very similar to the other one. So I think we have a really good chance because we have this grant and we're already familiar with CDC for the work that we've done. So I'm hoping that helps us. A couple other things. I'll put my glasses on. We are looking to restart our home visiting services week of July 6th. So we're trying to get our MCH nurse back into the homes as well as our EI service coordinators. We've developed our guidances in terms of the protocols for our staff making visits. We've also gotten some additional guidance today from the state, specifically for early intervention home visits. So we're taking all that and developing that. But we're looking to go live with those starting the week of July 6th. Let's see. Just one other thing on the reports. I apologize, we don't have a prevent report this week. That's mostly my fault, but the staff's been basically working on COVID-19 this week, so the last several weeks. So we'll have a more up-to-date report at the next meeting. Other than that, that's all I have. Oh, we did update the website. I don't know if you like it or not. It's an interesting thing. It's like whether or not LeBron or Michael Jordan is the better basketball player, is whether or not the people liked our previous website compared to this one. It's an interactive maps where you can hover over with a cursor and actually you can get the same data you did before, but apparently it takes a little more figuring out for people to figure out how to do that. But But you can go on the maps and you can look at the interactive maps. If you click on a township, it'll actually drill down into the township in terms of how many cases, and it breaks it out by age and demographics. So if you haven't had a chance to look at it, you may want to do that. It's actually kind of cool with that. But we'll be able to, that software is something that we purchased and we'll be able to use for a variety of things. We're going to actually apply it to the individual well water system grant so that we can use that for people in the community. They can use the interactive maps to identify what type of water quality we're seeing around the county too. So we'll be able to use that system in other ways within the department. But that change in the website went up about a week ago. We actually even put a little instruction video that Erica did that goes with it to show you how to use them if you need to. So other than that, I think that's all I have.
I see that you filled your registration for the upcoming rabies clinic.
Yeah, within like a day or two.
6 hours.
Oh, 6 hours? 6 hours. Yeah.
Wow.
Yeah, we had a lot of people calling and wanting their animals shot. So we're doing a drive-through rabies clinic, and we'll see how that goes. If that works, that might be our new model going forward. Yeah, we are, the health department and the county as well is open. Our doors are still locked, so it is by appointment only. We have a protocol that if you come here, you have to go get screened, temperature check, and then we direct you to our large conference room and that's where all the meetings or any interaction with the public will be held for the time being at least. And then after that individual leaves, then we'll wipe down the area. We're also going to be looking to start doing the clinic activities as well the first week in July. We're going to be staggering the appointments, farther apart for the same reason, the same purpose. But I mean, we didn't stop the clinical activities necessarily for the last 3 months. We had a couple of hepatitis cases that we had to get vaccinated, and some rabies that we had to deal with. So we were doing it sparingly, but now we're going to start reopening up those clinics. It's appointment only. We probably won't do as many numbers as we have in the past, but that's intentional due to we're spreading out the time between appointments. But that will get started July 6th as well.
Okay, anything else? Okay. I don't have a report tonight. Is Dr. Newton on the phone?
Yes, I am.
Okay. Do you have something for us?
No, ma'am. No new updates.
Yep.
Okay.
He doesn't have any. We didn't give him anything this week. That's like I said, we were behind. He was on top of it, but we weren't. So we'll be able to get that next time.
All right. Has John joined us?
I can't tell unless he speaks up.
Okay. Then we'll move on to any old business.
I don't have any.
Nothing?
No. And I already talked about the business stuff.
The new business. Does anybody have anything else that they would like to bring up?
I think I missed the beginning, so sorry. This is Rachel. But are there any active cases, or are you pretty much caught up on every?
No, there's 20 active cases right now. Did you hear me, Rachel?
20, and you have enough tracers and everything?
Oh yeah, that's never been an issue. Yeah, we have plenty of contact tracers.
Okay, does anybody have anything else?
So they switched the testing in the nursing homes to just once a week now? Is that?
I believe, yeah, that is correct. They went to once a week, so I'm sure the nursing homes are happy to hear that.
Are the nursing homes having to arrange their own testing, or do they all get sent to Wadsworth?
They have to arrange their own test. They have to arrange their own testing. I don't think Wadsworth will take them
Okay.
unless they have an agreement, have worked that out with Wadsworth. I believe like United Health uses Quest. Crowes Community is partnering with Community Memorial, so wherever Community Memorial sends the test to.
We go to LabCorp.
Yeah, and I believe, I'm not sure where the Grand's doing their testing, but they're having their testing done, as well as the Hamilton Manor. Hamilton Manor is coordinating, I believe, with, they might be coordinating with Community Memorial as well, but they have other offices like in Oneida, so I'm not sure where they're getting their staff done. They might be doing it in Onondaga County as well. We get the numbers. They send the numbers to Jennifer in our office in terms of how many they've had tested, so we know they're continuing the testing.
Anything else? Any other questions? Well, then I guess our next meeting will be July 27th. The location will be pending.
Correct.
Okay.
Need
Do we have a motion to adjourn?
I'll move.
Second.
Okay, all in favor?
Aye.
Bye.
Okay,
I,
everyone have a good night.
Thank you.
Thank you.
thank you.
Have a good night.
All right,
you.
bye.